I'm Dr. Esther from Cambridge Cat Hospital, and this here is Sherlock. Today I want to discuss administering medications to cats. The easiest way to administer medications to cats is to do it in a treat, like these pill pocket treats. Pill pockets are these sticky treats which cats seem to find pretty delicious. Here, Sherlock, have a yummy treat. So the pill pockets are specially designed, and you can put a pill in the hole, and then they're nice and sticky, and you seal them shut over top of the pill. A really important pointer with pill pockets, though, is that what you need to do is you always need to give some of them as treats. So you give one as a treat, and then what you would do is you would put the pill inside the pill pocket, and then you would give him the one with the pill in it after you've given one as a treat, and then you might want to give one more as a treat. You never want cats to learn that every time they have one of these treats there's a pill in it. There's always something in it, so you want to keep them fooled if they like them. I do sometimes suggest that people also use them as treats. As you can see, Sherlock thinks they're wonderful. Then in the future, if you ever have to give pills, it'll be easy because they'll already think that this is a wonderful treat. Some cats won't take the pill pockets because they're not a cat who likes treats, or maybe they have had a bad experience with the pill pocket. In that case, you have to do a pilling technique. I'm going to demonstrate the pilling technique now. I am going to use a pill pocket, not a pill. So what we're going to do is I'm going to take Sherlock's head in my right hand, which is my dominant hand, and then I'm taking the pill between my thumb and forefinger of my left hand, and I tip his head right back because that helps to loosen the jaw, and then I pop the pill way at the back of the throat. Then I massage the throat a bit. When he licks his nose, it means he's swallowed. Almost always a cat will lick their nose when they've swallowed. I'm going to demonstrate that again just with my hands. So I take his head in my hand and I tip it back. Sometimes it's easier if someone can hold the cat for you and you have two people to do it. One person to hold and the other person to give the pill, because as you see he's backing up a bit. So I'm going to take his head in my right hand, tip it back, have the pill between my fingers of my left hand, and he's not being too cooperative, which is typical. I'm going to put the pill way at the back of the throat, close the mouth, massage the throat, and when I let his mouth go and he swallows, because I stuck my finger back there, he almost always licks his nose. So that's a really good pointer. The two pointers that I find people don't always know about are having the head pointing back at the ceiling and watching for the cat to lick their nose. Now, if you're really having problems giving your cat medications and they need medications because they're sick, or even for something as simple as a urinary tract infection, we can order the medications in a special liquid form that's a flavored liquid from what's called a compounding pharmacy. The disadvantages of the compounded medications are that they tend to have a short expiry date and they tend to be a little bit more expensive. One other thing I wanted to mention is that if you are doing the pilling technique and shoving the pill down the cat's throat, it is a good idea to afterwards give them a treat, a little bit of canned food, something to help them swallow that pill down so that it does go all the way down to the stomach and doesn't sit in the esophagus. Thanks. We'll talk.